Welcome, everyone. We're so glad you can join us for this live webinar hosted by JFL Total Wealth Management to address Medicare and making informed choices about available plans. There are a lot of Medicare options, and figuring out where to start, especially if you are approaching 65 or have had a change in your health or financial circumstances, can be daunting. Today, JFL's Jerry Lynch and Bob Wasky, managing partner of All Things Medicare, will go over the who, what, why, and how much of Medicare. Our goal is to educate you on Medicare basics so we can follow up with a more in-depth conversation regarding your individual medical and financial situations. We encourage you to take notes during the presentation and send in questions through the questions feature on the webinar panel. We will answer as many as possible, and if we run out of time, your specific question will be addressed following the webinar recording. And a recording of this video and presentation will be posted on the JFL website in the next few days. Without further ado, let's introduce today's panelists. Jerry Lynch is a certified financial planner and founder of JFL Total Wealth Management. He has been a financial advisor for 23 years and has been working in the financial industry for more than 30. Bob Wasky is the managing partner of All Things Medicare and has more than 30 years experience in the financial and insurance industries. For the last decade, he has focused on managing healthcare expenses and finding affordable Medicare options for his clients. Welcome, guys. All right, so before we get started, we're going to do a quick quiz just to see how much you all may already know about Medicare. Most know that Medicare typically starts at age 65, but the question here is, what is the penalty for late enrollment in Medicare Part B if you don't enroll at age 65? So is it 10% of your premium for each year of late enrollment? Is there no penalty if you're covered by your own or your spouse's employer-based health insurance? Is it 10% of your annual income? Or is there no penalty if you're covered by COBRA from a previous employer? So this was actually a little bit of a trick question. The correct answers were actually A and B, which is 10% of your premium, or it could be no penalty if you have your own employer-based insurance. But these are just some of the topics that Bob, will go over during today's presentation. Jerry?
Hello, everybody. Again, just to kind of set things off today, Medicare is one of the most important benefits that anybody's ever going to have, especially when you hit retirement. Health insurance, as we get older, becomes more and more important. The decisions that you make on the type of plan that you choose can have an impact on, A, first of all, how much does it cost, and B, how much does it cost out of pocket when you're seeing physicians. Now, again, previously in my old job, I was doing health insurance on a regular basis, and really what I found out is that it's getting way too complicated. And what we try to do with the financial planning programs that we offer is bring in specialists in areas that are way beyond our pay grade so that we can bring in people who really know this stuff and help you make better choices with your money. So we're going to go over a couple of things today. Number one, Medicare. What is it? How does it work? We're going to go over the enrollment periods. We're going to go over the cost. Now, again, Bob has worked with us for quite some time. Many of you who have already met Bob. He's helped my family members and friends. We are not using his picture today because Bob looks like Richard Gere, except he's younger. And we just figured everybody would be totally distracted when you saw him. So without that being said, Bob, why don't you start and tell us a little bit about Medicare and make our lives a little bit better. Thanks, everybody.
First, I want to thank you, Gretchen, for putting this all together, and obviously Jerry for having me on. And for those of you who have met me, not quite Richard Gere, but I'll take it. So first thing is, today's not about becoming an expert, but it's really to start to familiarize yourself with the language, the process, and really understand some of the key things you need to understand so you don't make mistakes. And knowing that you need to reach out to someone. So when Jerry said it's complicated, it can be. It's complicated because people make it complicated. You get 50, 60 pieces of mail, you talk to different brokers, your friends tell you things. But it really, when you break it down, it's pretty straightforward relative to coverage you have when you're under 65. So let's start with the four parts of Medicare. There's really 3 parts of Medicare, and then kind of the C is a kind of a 3A. So everybody, when they turn 65, or sometimes when you're under 65, special situations, you're eligible for Medicare Part A. Think of A as your hospitalization, the facility charge, the cost per day. Medicare Part B, doctors related services, any screenings, testings, surgeries, physical therapy, durable medical equipment, which would be your wheelchair, crutches, anything done by a doctor or related service. Anything done by a doctor in a hospital is B. The hospital is really just the daily rate. Okay, so you have A and B. That's called original Medicare. And everybody at some point gets that. They don't always get it when they're at 65. Going back to that earlier slide, the quiz, we'll get into when you do it and how you do it. And then everybody needs some form of prescription coverage. It's got to be creditable from age 65, whether it's with an employer, retiree plan, you could have VA benefits, or you go into the Medicare, get Medicare Part D prescription plan. Okay, they're either standalone or getting to the Part C, they can be combined. So what is Part C, Medicare Advantage? Those are all the commercials you're seeing today. That's where companies are being paid by Medicare. You forfeit your A and B benefits. You still have to pay that cost, which we'll get into for Medicare Part B. But private insurance companies are going to provide either HMO, PPO networks. That'll be a key discussion point as we move forward. And they sometimes combine prescription plans. Okay, next slide. Okay, this is a key slide for people. This is really, think about is your path. You're going to choose at some point a direction. It's going to be left-hand side or right-hand side. So first of all, like I said, everybody at some point obtain Medicare A hospital. For most people, there's no cost. You've worked 40, 50 years, contributed to Medicare system. As long as you've got 40 quarters of coverage, you're not going to pay a monthly premium for Medicare Part A. Part B, however, there is a cost associated, and it's going to be based on your income. It's going to be based on your income from 2 years prior, which we'll get into. So A, B, everybody has it. If you continue with original Medicare, your availability, every single hospital accepts Medicare, and then almost every doctor, over 90% nationally, accept Medicare. So very, very comprehensive, very, very stable, and that's going to have, it's going to continue out. Then the benefits of Medicare. Medicare pays a lot, but not everything. There are some deductibles. There are some copays that are associated with your plan. And that's where, if you continue on this left-hand side, you would go and get potentially a Medicare supplement or a Medigap. Gap meaning it pays the gaps in coverage that Medicare doesn't cover. And we'll get into that later. And for anybody who's on the left-hand side, again, A and B, that's your hospital doctor coverage, your medical coverage. You do need a separate standalone Part D prescription plan, unless you've got coverage from another resource. Okay, now the other option is Advantage. Under this, like I mentioned, now you still need your A and B, you still pay your Part B premiums. Some people think that you can avoid that. No, you still have to pay it. However, you're then forfeiting your Medicare coverage, your hospital network, your doctor network, and then Medicare is paying individual companies to build proprietary plans, similar to how you have today at your company or through the marketplace. They're HMOs, they're PPOs. They're going to have benefits that are somewhat similar, more narrow networks, which we'll get into. But that would be an alternative. And then if you do go in that direction, many times they're going to bundle in your prescription plan. So it's not a separate plan, it's part of your Advantage plan. Okay, next slide, please. All right, so this gets into it's the when. And there's 3 ways to enroll into Medicare, depending on when your enrollment is. There's really only 2 ways that are preferable. The third way we'll get into is probably not an option you want to go with. So again, when you turn 65, you're eligible the first day of your birth month, unless you're born on the first of a month, then it's the prior month. So you're going to start, if you decide that this is the right time. So my birthday is April 8th. I would start April 1st. I'd be eligible to enroll, complete my application anytime in January, February, or March. You don't need to do it January 1st or in January. A lot of people think there's a penalty. No penalty. As long as you're in that 3-month period, you'll start the first day of your birth month. And then you also have an option to enroll 3 months after. Okay, that's initial enrollment. Most people fall into that bucket, but not everybody. We'll get into when it makes sense and when it doesn't make sense to enroll in Medicare A and or B. So for anybody who's working, and this has become more and more common in the last 5-10 years, people work after age 65. If that's the case, you're going to delay, in many cases, your enrollment into Medicare. And when you do decide to enroll, you leave your company plan at age 67, age 68, whatever years, age 75. As long as you've worked for a company with more than 20 employees, you can delay your enrollment in Medicare Part A and B, and you can enroll whenever the time is right. The company fills out a form for you. You have a Medicare Part B application that gets faxed to your local Social Security office. Okay, so when do you enroll in Medicare on your initial period? You have a marketplace coverage, Obamacare. You work for a company with fewer than 20 employees, or you're retired. Then you'd want A and B, absolutely, to start when you turn 65. When do you want to delay? You're at a company. You're at a large company, more than 20 employees. That's considered large. You can get your Medicare Part A to put yourself in the system. Delay your B. Why would you delay your B? Because it provides no benefit at all to you, but it's going to cost you every month to have Medicare Part B. And there are some other reasons you wouldn't want it in terms of losing some potential options in the future. Now, most people get their A, they want to at least be in the system. There are times when you don't want your Medicare Part A. If you participate in an HSA, you lose that pre-tax ability to contribute. So a lot of people think they have to get some form of Medicare. Absolutely not. And this is where you'd want to call us or call somebody who's a good resource. Sometimes you call Social Security and they don't understand because they're not listening. You're not articulating your situation correctly, or they may not understand it. But HSA, employed, over 20 employees, no A or B. Regular account, your regular standard benefits, you can get your A, set you up in the system, makes it easier in the future. You delay your B. Okay, if you work for a company with fewer than 20 employees, Medicare is now primary. So forget about what I just said. You need your A and B, or you'll have no coverage. Okay, now this third period, this is general enrollment period. This is the one you don't want to be in. If you miss these windows, then you can't enroll in your Medicare until the following July. So it's already October. I missed my window. I would enroll January, February, March. It wouldn't go into effect until July. I'd be subject to penalties, increased premiums, lifetime, and also I'd have no coverage until July. Okay, thanks. Next slide. Thank you. Okay, so this is the part about Medicare Part B. So like I said, no cost for A for most people. Medicare Part B is based on your adjusted gross income. It's actually modified adjusted gross income, pretty much adjusted gross income from 2 years prior to your enrollment. So you file jointly, you go to the second column. Your income is below $174,000 in 2018. You're going to pay $144.60 a month. Husband and wife are going to pay individually. These aren't combined. Single, $87,000. Now say your income is $285,000. So then you go down to the fourth row, and you're going to pay an extra amount. It's called IRMA, Income Related Medicare Adjustment Amount. This is a shock for people. In this case, you're not paying $144, you're paying $376. And you also need to pay a participation rate for your Medicare Part D. So B is extra, D is extra. And that can be shocking for people. Now, two things. One is many people who leave their company, they retire, their income goes down. Income goes down, there's an opportunity to do an immediate appeal based on one of the 7 reasons, which is reduction in hours, loss of job. So just know that this is very important. This is where you want to really work with your financial advisor. Jerry's very familiar with this. He helps people all the time. A lot of people don't know about this, and they keep their they keep their IRMA high cost for a 2-year period when they can reduce it right away immediately. All done through Social Security, special forms. We can work with you on that, how to do it. Very successful. This will work for you without a problem. Okay, the other thing is, Jerry, for example, he can help you manage your distributions. Maybe you take advantage of Roth contributions. They don't count for tax purposes. Or if your income looks like it's going to be right at the threshold, maybe you delay some income to put you at a lower tier and save money. This is a key slide, very important for people. And this is the reason you see why you don't want to get your Medicare Part B when you're still working and over 65, because you're paying for something that gives you no benefit. Okay, next, please. Okay, now we're going to get into we did the A, we did the B. Now we're going to get into the prescription coverage. So how are drugs covered? There's 3 factors. There's an annual cost, and then this is this is the most complicated part for you at some point when you do go into Medicare, because you do have to make a decision every year between October 15th and December 7th. New plans come out for the following year. There are going to be 28 to 30 plans depending on your state, and they're going to be complicated. This is kind of an overview of how the car is built, but we're not going to get too detailed here until the time is right. So you've got 3 things. You've got a premium. Everybody pays a premium, anywhere from $7 next year up to over $100. The average around $30. Okay. The other thing is you do need to have a prescription plan. If you don't have a prescription plan, you're going to be penalized for every month without one. So no medications. You still want to have a low cost plan. So you pay a premium. And then of the 28 to 30 plans, over 2/3 have a deductible. Again, some are 0, but those other 2/3, they typically are in the $445 range for next year. But that deductible, and then you have copays based on your prescription tier. So you go to the right side though, every medication falls into a tier. Preferred generic is their lowest, up through tier 5, which is specialty. Now going back to that deductible will only apply for virtually all the plans if you have a tier 3, tier 4, or tier 5. So atorvastatin, Lipitor is the brand. That would be the brand Lipitor. That's a tier 3. That would be $400 or $500. You're subject to a deductible. Atorvastatin, you're going to pay $0 to $2. That's the generic. So you see that the preferred brands, non-preferred brands can be very costly. Sometimes there's no alternative. Jardiance, Eliquis, for example. In that case, that's a $400 or $500 prescription. You're going to pay your full cost, and then once you reach that, you're going to pay roughly $40, $45 copay. Okay, so this is, again, every year you want someone to run this, or you can go into the Medicare site. It lists all the plans and do an analysis. Okay, we're going to cover the copay changes on the next slide. So here we go. This is where we talk about copay changes. So I mentioned every medication falls into a tier. You reach your deductible. You're in your initial coverage. You're paying your copay. Once the full cost, not your cost, but the full retail cost of your medications totals $41.30, then you go into phase 2, which is called, or phase 3 in this case, which is called the donut hole or coverage gap. In that situation, you're paying 25% of the retail or full cost of your medications. So you have that Jardiance, it's $450 a month. You're paying $45 a month. When the full cost of all your medications combines, the retail cost reaches that $4,100, then you're paying 25%. You go up to $100. Okay, then this catastrophic piece, that's where if you do reach a certain level, kind of the next phase of cost, combine your costs with whatever the drug company is contributing that goes through it, called true out-of-pocket. Then you reach catastrophic, where you're responsible for 5%, up to 5%. Okay, there's no maximum out of pocket. Just know that when you get to a certain amount, your costs will go down. Okay, so you see it can be confusing. We just put all those pieces together, put it into the blender. Every year in October, we run those plans for people. And it's very important because this can be tremendous amount of savings or cost if you make mistakes. Okay, next slide. Okay, now we're going to get into that's the Medicare Advantage or the Part C. And this is an option. This is an alternative to original Medicare. So what you're doing is you have individual companies, private insurance, HMOs, PPOs. They're going to now combine the benefits of A and B. They're going to create their own programs. So under Medicare Original, you'd have a deductible of roughly $1,400, and then everything is covered for 60 days. Under these plans, it might be $450 a day for 6 days. And then they're going to have certain costs. Same thing with the Part B. Under Part B, under Medicare, you're responsible for 20%. Medicare pays 80%. These are going to have specific cost structures that are unique to each plan. Right? They typically are more HMO, PPO. They're geography restricted, meaning they're going to be different by county, different by state, and they're going to have very limited out-of-state networks. They really typically don't emergency services. So they do combine the Part D. We mentioned that earlier. Sometimes other dental, other ancillary benefits. And just like the Medicare Part D plans, these plans are going to change every year, October 15th to December 7th. They could change, they could be discontinued. You want to be very proactive if you go into one of these plans. Check and see if your doctors are in network. Check and understand the costs. And also make sure if your plan changes, you're going to continue to review those. Advantage plans, what's the benefit? One key benefit is they have lower premiums. They do have some of those ancillary benefits. But again, more restricted networks, and they also have higher costs for services if you're approved for the different services. Okay, the one key benefit also though is you never lose the opportunity to enroll into an Advantage plan. So you get an Advantage plan, you decide, okay, I don't like that plan, or I do like that plan. Every October, you can make the choice to continue. Okay? All right, Medicare supplement. I don't know if you can hear in the background. It's my grandson is calling from Amsterdam. My son's with him, so my son works back there, so they're all excited. All right, so Medicare supplement insurance, national coverage, all 50 states. Every hospital, over 90% of your doctors, you need to go to Sloan Kettering, you go to Sloan Kettering. You want hospital special surgery. My mother got, her shoulder fixed by the New York Giants team doctor, Dr. Russ Warren. She didn't pay for it because she had a Medicare supplement with Medicare. Okay, guaranteed renewable. This is a real important point. They're guaranteed renewable if you're in a plan. You have an open initial enrollment period where you're guaranteed coverage for the first 6 months after you get your Medicare Part B. After that, you can always move into one, or you can change plans, but only if you can answer health questions successfully. So they don't have to let you back in. They don't have to take you, and that's how they keep their rates stable. They do have higher premiums, but you're going to have limited to no out-of-pocket costs. Here's a sample, 10 standardized plans. Medicare provides a structure that's standardized. Different companies provide a D, an F, a G, an N, for example. Same exact benefits, different pricing. Okay, so we're going to go to the next slide. These are the 3 most common plans. First thing I want to note is anybody born in, basically anybody who's turned 65, this is a little bit, this says January 1, 1965 on the note. Anybody who is 65 starting this year is no longer eligible for an F. There's been some changes. Okay, so think of it this way. The F plan pays all your co-pays, all your deductibles. So you've got everything covered. Anything Medicare doesn't pay, your plan will pay. The G plan pays everything except the first $198 annual deductible, but you're paying a lower premium, right? So you're going to pay a lower premium. Typically, when you add the monthly savings, it's always going to save you over the F plan, because you have to pay, maybe you're paying $400 or $500 more a year to avoid a $198 deductible. No brainer. Also, with the F plan being discontinued for people newly eligible for Medicare, the youngest person in 5 years on the F plan will be 70 years old. Older population, the F plan is going to raise their premiums at a faster rate than both the G and the N. Because the G and the N, they're going to continue to be available. They're going to be open to anybody who first turned 65, younger population, and anybody can get in if they're healthy, but if they're not healthy, they can't get into those plans. So difference between the G and the N, you have that deductible, same, but there are some additional extra charges. One is a copay for doctors, $50 for emergency if not admitted. And in some cases, most states, if a doctor participates in Medicare, but doesn't accept the standard amount, then you can be charged in excess of up to 15%. It's not common, but it happens. Okay, so that's your supplemental plans. All right, so let's wrap up with best practices, mistakes to avoid. And I'll take any questions. And for anybody who has any questions that are personal, individual, you can call me, email me. We'll be happy to answer them for you. And we never charge a fee. There's no cost for that. So first, you want an independent resource. You don't want to necessarily speak to the first person who contacts you. They may be a broker who's competent, or they may just be a call center rep who represents one company and tries to put you into a specific plan or mislead you about when you need things. Know when and how to enroll in Part B. That's critical in that there's penalties if you make mistakes, and the other cost is if you enroll too early, you're going to pay for something you don't need. Appeal the IRMA, right? If you are subject to that higher amount for Part B, make sure you take the opportunity to reduce it if your income is reduced, right? Medicare and HSA restrictions, we went over that. Remember, the HSA is a pre-tax benefit. You can't be part of any form of Medicare if you contribute to an HSA. Okay, and then annual review. Always be proactive. Every October, review your plans, review your prescription Part D plans. If you're on a Medicare Advantage plan, do that also. We sent out 2,000 communications just 2 weeks ago. Today's the first day of the annual enrollment period. We've gotten back over 1,000. So we'll be reviewing everybody's prescriptions, make sure they're on the right plan that's best for them. Okay, mistakes to avoid again. Marketing mailers, don't get overwhelmed. You'll get 60, 80 pieces of mail from the time you turn 64 to the age 65 and for the rest of your life. 1 and 3 kind of come together. Again, don't share too much information with online searches. You have an online search, you put your name in there by mistake, you give your contact information, oops, you get called by 15 different brokers because they're going to sell your information. There's no way to get this information very easy in most cases. Okay, again, back to the mistake number 2. Don't assume Medicare isn't needed if you're 65 plus. If you have COBRA, for example, from a former employer, that doesn't count as creditable coverage. So you're 68 years old, you're given a year free benefits, COBRA, they're paying for it. It's COBRA, that means it's not considered creditable. You need Medicare Part B and Part A. If you don't have those, Medicare is now primary, your plan won't pay the benefits. And then last thing, don't allow gaps in coverage for D. Remember, you need continuous coverage or you're penalized for every month you don't have one. Okay, thanks.
Just to kind of wrap things up real quick, again, Bob, thank you very much for that. I found that incredibly helpful. Number one, I think it's important you take a look at this today. Now, if you are over 65 and you're eligible for Medicare, my advice is have Bob and his team take a look at all this stuff at this time. If you're not 65 yet, let Bob get through the enrollment period. And I would say let's contact him and have a good conversation with him about what you and your spouse needs to have for Medicare going forward. Understand the enrollment deadlines, making sure that you're aware of the timing of these things, which is critical. I don't want you to have a penalty that's going to hit you for, literally forever. Avoid mistakes and penalties. And use independent resource. Now, again, when we send people out to Bob, we as a firm do not make a dime on that. I don't want to make a dime on that. I just want to make sure that Bob is taking care of you and giving you the best service available. So that's the reason why we use them. I don't trust a lot of the 800 numbers and the other resources that are available. So we screen people for you to make sure that if I send them to you, they are very good at what they do and they're going to take care of you. And finally, make sure the Medicare costs and coverage are part of your annual budget. Understand the costs that are associated with this. And again, we go through this in our retirement planning and have that built into our retirement plan. So just again, recapping as an overall financial plan, the most important thing is very basic: live below your means. You know, if you're making a certain level of money, live below that, save on a regular basis. If you get an increase in pay, save a good part of that. The biggest concern I always have for people is that when their income is up here, when they're working, you can't get to here when you retired. You got to slowly bring it down and make sure that your expenses are staying at the lowest level and that your income is being saved. There's a big benefit of that. Automate your systems. I don't write a check for anything. My bank account automatically sends money to my mortgage company. It automatically sends money into my investment account. I don't have to do anything other than think about it and every once in a while make some small moves. Get your estate planning documents in order. Part of Medicare is who has your medical power of attorney? Who is your living will? Are those been updated? We review thousands of documents in this area, and most of them that I see before people come in here don't make any sense. And I want to make sure that they make sense. And then finally, be proactive with your advisor. If it's us, great. You know, again, we're going to be meeting on a regular basis. We're going to review this. And if it's not with us, make sure whoever you're working with is doing this and looking at all this information, because it's important to work together. And one last thing too, we have our newsletter coming out. It's going to be out probably next week. We actually have a nice article from Bob on Medicare. And if you or any of your family members want to get a copy of this, please let our office know, a family member, friend, whatever the case may be. I think there's very good information in it and it should be helpful for you. So that being said, let's get to some questions.
Sure. Thanks, Jerry, and thanks, Bob, for that great presentation. We have a couple questions that have come in. One was, can Medicare help pay for expenses beyond what my company's health benefits provide?
Sure, that's a good one. That's something I'll clarify. That's a really nice one. So pretty much, if you work for a company with more than 20 employees, Medicare really doesn't have a role, as long as you stay on your employer plan. If you're under 20 employees, yes, Medicare is primary, and you absolutely have to have Medicare, because that 20% I mentioned is covered by typically the person. Medicare pays 80% for Medicare Part B. That Medicare Part B, 80% wouldn't be covered because you don't have Medicare Part B. Your employer plan doesn't have to cover it.
Okay. One person wrote in, if you are making an appeal, I guess the IRMA appeal based on the amount of a change of income, do you have to do the appeal for each individual if it's a married couple that's filing jointly, or can you do it together as a pair?
Yep, so here's the process. Basically, when you get your IRMA assessment, it's based on your joint income if you file jointly. So even though that you pay individually, the amount is set based on your joint income. So what you do is you call your local Social Security office, which we have the numbers. You tell them your situation. They have you fill out a change. Basically, it's a change form. You're telling them your estimated income going forward. They've been very flexible. Both of your Part B premiums get adjusted.
Okay. Someone wrote in, if you're kind of in that the lowest tier of income, is Medicare basically free then?
No, Medicare is going to be $144.60. That's the minimum. Now that's this year. Next year it may go up a few dollars. It hasn't been announced yet. Cost of living has been, but not your Medicare changes. Now there are sometimes, if your income is very low, there are potentially reimbursements that the government will provide. It's got to be very, very low income.
Okay. Someone was hoping that you could maybe clarify this. If Part B is based on income, does the premium change every year based on your income?
Yeah, so that's a really good question. So here's an example where your income may be low 2 years ago. Not low meaning it may be at the first level. You're paying $144.60. You retire, you're age 67, for example, and you receive a big bonus, a big payout. That's your income's going to go up. So your Medicare Part B, when you reach that time period where that year is relevant, your income could go up. I mean, your Medicare Part B assessment could go up.
Okay.
What you want to do there is, if you have any questions about that, it is very tricky, and there are some not tricks, but there are some things that we can potentially do to position you favorably. It's how you word some of your statements and how you document things. So if you have any questions about that, just always contact us. And back to Jerry's point earlier, we are busy right now, but we're always busy. Anybody who's over 65 on the call today, if you have any questions, especially about your Part D coverage, your Medicare coverage, we're here. We'll take the time to answer your questions, so don't think twice about that.
Okay. Okay, I have two more, and then I think we'll probably wrap everything up. One question was, if you may be able to provide a little more information about what out-of-pocket costs are involved with Part A and B in terms of co-pays, deductibles, and co-insurance.
Yeah, I didn't want to go too crazy, but if you don't have any other coverage, your Medicare Part A, you're paying a deductible, hospital, for example, roughly $1,400. Once you reach that, you don't pay anything additional for 60 days. From 61 to 90, you're paying now a copay. 91 to 120, you're paying a higher copay. Same thing with a rehab facility. There's a daily amount that you're going to be responsible for. Okay, now for Medicare Part B, Medicare, after you pay a deductible of $198, Medicare pays 80%, and then you'll be responsible for 20%. And then back to that doctor, if he or she charges more than the Medicare allowable, it could be an extra 15% above that amount. That's for B, not for A. Now, if you have a supplement or Medigap plan, always your hospital portion, your facility charge is always covered. And then if it's an F, all your Part B is covered. If it's a G, everything except that deductible of $198. If it's an N, it's going to have some extra co-pays potentially. Now, dental's not covered. Your vision's not covered under Medicare. However, ophthalmology, cataract surgery, cornea, that is covered. Advantage plans are a whole different animal. Those are going to be specific because Medicare now is providing these companies with a bucket of money to build their own proprietary network. So they're going to differ based on the 30 plans available.
Okay, great. Thanks, Bob. And then one last question for you. Can you appeal your premium? So basically you're appealing your IRMA. Can that be done at any time during the year, or is that only done during the enrollment period that begins today and runs through December 7th?
Yeah, so the enrollment period is an annual period for prescription plans and for Medicare Advantage plans. Supplement, you can always review your plan and make changes if you can qualify. The Medicare Part B, I have clients all the time who they'll find out, through us or through their financial advisor, that they've been paying for Part B for a certain period of time. No constraints at all. Whenever you find out, you get to us and we'll help you with the appeal. The other thing is if you're still working and you got your B by mistake, you can suspend your B. Or you have Medicare Part B and you go back onto a company plan because you get a job. And you can suspend your B. Once you're on it, that doesn't mean you're on it for life. You can come off if it makes sense and then go back on without any penalties. That's a good question.
Okay. All right, great. Well, thank you everybody for sending in those questions. And if we weren't able to address something that you would like to discuss further, please let us know and we can follow up with you. So that brings us to the end of today's presentation. And we realize that it contained a lot of information to digest about Medicare plan options. As we said, we recommend that you download a copy of this presentation from the webinar panel. And if you have any other questions or would like to speak with Bob about your particular situation, please reach out to the office and we'll set up an appointment. And we will send a link of this recorded webinar to everybody that registered as well. So stay safe and enjoy the rest of the day.
Okay, thanks everybody.